excuse me, go ahead and hang up and you can watch the recording afterwards. All right, I think we're good to go, Greg.
All right, perfect. Well, thank you all for joining today. As Stacy said, I'm Greg. I'm a field epidemiologist with the Colorado Department of Public Health and Environment. Our team that I'm a part of has been pretty highly involved in the highly pathogenic avian influenza response. So we're just going to do a little bit of a presentation on kind of what the virus is, the background, the impact to the community. Since it is indeed a mouthful to say, HPAI is usually how we shorten it. So if you hear me just say HPAI, that's what that means. So I'm going to go ahead and start sharing presentation. All right. Hopefully everyone can see.
Yep, we can see
Okay.
you.
Perfect. All right. So, so first we're gonna go through just a little bit of background on it. So, HPAI falls underneath of influenza A. So it's an influenza A virus, and they are endemic to the United States and a lot of places around the world. They regularly transmit in animal species, usually pretty specific to the species. So you heard avian flu, swine flu, things of those natures. They usually transmit in there. Every now and then, it'll jump over into humans, and we'll have events there. We also have some human-specific ones. So influenza A viruses are the only ones that are known to cause pandemics. So they do have a little bit more of a infectious nature than as compared to influenza B or the other non-human infecting influenza viruses. So HPAI, highly pathogenic avian influenza, is specifically a couple strains of. Oh, is this still showing the presentation for you all? Sorry, I can't quite tell.
Yep, it is.
Okay, perfect. Sorry, I have some notes on a separate tab, so I just wanted to make
Okay.
sure that I was not switching away from the presentation on there. So, highly pathogenic avian influenza is one of the influenza A ones. It was initially detected in it's an H5 and H7 are the two strains that cause the severe disease and the high mortality in poultry. It was predominant in Asia, Africa, and Europe, and then into the Middle East by the end of 2021.
Sorry,
And
Greg.
then,
If
okay.
if you haven't muted your phone, please or mute yourself. Jean, if you could mute yourself.
No. Answer's no. Not that I know of, no, because we have.
Okay, we're good.
So, and then the virus is detected in Canada and the US in late 2021. So by March 2022, H5N1, which is a specific strain that we have, was detected in wild birds in Colorado and has since impacted millions of our wild migratory birds as well as commercial poultry across the state. So we specifically are having 2.3.4.4b, a little bit of a mouthful, but that's the specific clade or basically subtype of virus that we have here in the state right now. So this right here is just kind of a little bit of the overview and history of avian influenza in the United States. Really, the main point is that we want to show is that this is not something that's new. It's been going around inside of birds and people for quite a while. I mean, our timeline here dates all the way back to 1918 with the what was called at the time the Spanish influenza, but it's believed to have been caused by an H1N1 type avian like flu virus. So this is not something that's new. Unfortunately, it does come around in a rather cyclical nature with migratory bird patterns, and it stays pretty relevant, unfortunately, year after year. So in Colorado, we have three main agencies that deal with HPAI. So the first and main one is the Colorado Department of Agriculture, CDA. So this is our primary agency that we deal with that works with domestic poultry. So they partner along with us, veterinary services, including APHIS and the USDA, CPW, but they deal mostly with domestic birds. So they're going to have your poultry, any of your game bird farms, anything along those lines. The other agency that we partner with quite regularly is the CPW, and it's Colorado Parks and Wildlife. So they are the lead agency for any of our wild birds or wild mammal detections. So they also work pretty jointly with us, the U.S. Department of Agriculture, Colorado State University for our testing labs. And then finally, the human component is Colorado Department of Public Health and Environment. So we work with them to identify the CPW officers or CDA officers or individuals on the farms that may have been exposed to avian influenza, and we help get them testing if they need it, treatment, or self-monitoring for symptoms, which we'll go over all of that shortly as well. So this is pretty aggregate, overview map of everything that is of all the different species and birds that we've detected throughout the counties here. So Boulder County is, as you can see, or Boulder in there is green. So we have had positive mammal cases and domestic or wild birds. We have some rough counts of infected domestic birds, wild birds, and mammals. So this full map is available on the Colorado Department of Agriculture's website, and it's interactive too, so you can click on it to get counts and to get information about it. But we really want to highlight that we are getting cases everywhere in the state. This is indeed a statewide response that is being mounted to this, and we do monitoring across the entire state. CDA does monitoring across the entire state, and CPW responds to instances across the entire state. So not just one area, not just along the Front Range or the Plains, but we do have things popping up across almost every county. So I want to transition a little bit over into HPAI and human health. So transmission of it occurs when an individual is exposed to the saliva, the mucus, or the feces from infected birds. And if enough of the virus gets into a person's eyes, nose, mouth, inhalation, one of the mucous membranes that we have, that is when a human infection can occur. So we recommend that individuals use PPE or personal protective equipment for anyone who has an occupational risk. It's gloves, mask, eyewear. So that's for wildlife officers, poultry farm workers, anyone who's going to be dealing with birds in a close proximity a lot of the time. So one thing that is very important to note, however, is that for the H5N1 clade of 2.3.4.4b, so the one that we currently have circulating, there has been no human-to-human transmission. We have had a case detected in the United States, in Colorado, of H5N1. There has been no human-to-human transmission, however. So anytime that a person is exposed to a animal that tests positive for avian influenza, we talk to them, and we look for certain signs that would mean monitoring. That would require the individual to be monitored. It's a voluntary monitoring system, but we either have active monitoring. So anybody who was exposed to a sick bird, they did not have PPE, had incomplete PPE, or there was a breach in their PPE, we recommend an active monitoring, which is basically where we just check in with them on a daily basis for the 10-day exposure period to see how they're feeling, how they're doing, if they're having any symptoms, and if they are, if we can get them connected to any testing at their primary care provider. We have passive monitoring. So if a person was exposed to a sick bird, but they're wearing all the PPE, we ask them to monitor themselves, keep an eye out for any symptoms they may be experiencing, and then they can report anything to us so we can assist getting them any testing that they may need. And then, so as I mentioned, monitoring is optional, but recommended for those that are at risk of infection, as it just helps us kind of get to them quicker, be able to get access to care, to treatment, or to testing a little bit quicker if we're able to kind of coordinate that with the person rather than having them just have to worry about dealing with all of that by themselves. So human signs and symptoms of avian influenza: you have generally a fever, which is a temperature over 100 degrees, cough, sore throat, difficulty breathing, headaches, eye tearing, redness or irritation, runny or stuffy nose, body aches, and potentially diarrhea. So as you can see, most of these are relatively common respiratory symptoms that we see in people with non-H5N1 influenza, COVID, RSV, anything along those lines. So it's it's very difficult. It cannot be diagnosed purely based off clinical symptoms. We do have to do laboratory testing to confirm that. And we do have a panel at the state lab that we do test for avian influenza on that respiratory panel. So just some information for the general public. This is kind of in like a frequently asked questions format. So what if I see a dead or sick bird on public lands? So while the risk is low, we absolutely recommend you do not touch the bird or have any person touch the bird. Avoid direct contact with them, observe them from a distance. Do not touch any dead birds. You should contact your local CPW. If it is a dead wild bird, you can notify your local CPW office and they can handle any of the sick, dying, injured birds, anything along those lines. If you do have anyone as a hunter or no hunters, that is something that they also should be aware of. CPW does have a link in here with good advice for hunters on you kind of identifying birds, staying away from infected birds, keeping themselves and their animals safe from the hunting dogs and everything safe from that. If there's a dead bird on your private property and removal is necessary, we do recommend you wear the mask, the eye protection, and gloves. Immediately double bag it and place the bags in your municipal trash. So you could discard the gloves and mask, wash your hands immediately afterward with soap and water, do the 20 seconds, sing the ABCs, whatever it is you like to do to get that time frame, or use an alcohol-based sanitizer that has to be at least 60% alcohol. Once you have touched the bird, please do not touch your face. Don't remove all of your PPE with dirty hands. Don't start rubbing your eyes, anything along those lines. Just be as safe as possible when you're doing that. It's a less than ideal situation, but this is by far the best advice we have if you do have to remove a dead bird from your property. So is it okay to use bird feeders? This is one that we actually tend to get quite a bit. So bird feeders are not thought to be a major source of transmission. They are a source of transmission of other diseases amongst birds, such as salmonellosis, conjunctivitis, and trichomoniasis. That's not one that I normally deal with. I apologize. They also can be an attractant for bears, but we recommend you take them down actually during times of the year where natural food sources are abundant to the birds to help reduce any spreading of that to the birds and also to decrease the number of bear conflicts. However, with it being a little snowy and a little bad, a lot of people tend to still have their bird feeders up. So a couple tips for that: we do recommend you use multiple bird feeders to avoid any kind of overcrowding at it. Don't feed on the ground or on a platform feeder or anything where birds may defecate down onto a platform where other birds are going to be eating. We also recommend cleaning the feeders every 2 weeks. You can use it in the dishwasher. You can do soap and water, bleach solution, just something to clean and kind of disinfect that surface for any of those birds. Keep the feeder dry. Once they get really wet, it's kind of breeding ground for some of that, and it creates a little bit of a fungal risk as well. Like I said, regularly eliminate any feed from the ground. So I know that birds, they tend to knock a lot of the stuff over. Squirrels get into the feeders. But just doing your best to try and cover that up on the ground to prevent them from eating where other birds and animals are defecating onto. And then wear gloves and wash your hands after you handle the feeders. Just some basic precautions there. So I know a lot of us like to have bird feeders out, especially at this time of year, to help them. So these are just pretty good tips to help limit the spread within our bird populations. And so what should you do if you've been exposed to HPAI, or you believe you've been exposed to HPAI? So I said the risk is very low. If you believe you've been potentially exposed to HPAI, you should monitor yourself for 10 days. That is our recommended monitoring period, is 10 days from your last exposure. So if you're exposed over a couple days, 10 days from the last date of exposure, contact your healthcare department, your healthcare provider and your local healthcare department or health department. Apologize. If you experience any symptoms of a respiratory illness or anything like that, like I said, avian flu is pretty hard to distinguish from other things such as RSV or COVID. But if you develop any respiratory symptoms, we highly recommend you reach out, inform your primary care provider, inform the local public health agency. And then they will be able to help get you the appropriate testing. If it's deemed necessary, we'll be able to help get you the appropriate testing, and your primary care provider and the local public health department will be able to give you more specific recommendations to any treatments you may need or any kind of precautions you may have to take. So is there a treatment if you do end up getting avian influenza? So there are antiviral drugs that are available for people who get sick, and it works best if it's started as soon as possible. So if you believe you or anyone you know may have come in contact with one and they start experiencing symptoms, it is very vital that you contact your primary care provider and your local health department immediately to kind of start setting up testing for it, because the sooner we can get treatment if an individual is affected, then the quicker that they can recover and the better outcomes that we are observing, the quicker they can get that. So, and one thing we get, because it happens quite common in our commercial poultry ones, is it safe to eat chicken? What about eggs? So avian influenza does not present a food safety risk. So poultry and eggs are perfectly safe to eat as long as you handle them properly. Avian influenza is not the only thing that can come out of raw chicken. So proper handling and cooking of all poultry and eggs to an internal temperature of 165 degrees is recommended just as a general food safety precaution. So another thing we also get, how can I protect my household cats and dogs? So risk is lower to your cats and dogs than it is to any of the birds in there, but your animals can still become infected with avian flu if they go outside and are eating dead birds or sick birds, or are kind of, rolling or eating in goose poop or any of the other migratory bird feces. So it's, as much as it's kind of difficult to always monitor them, it's a good idea to keep that contact down to a minimum. So if you know that you have a lot of geese in the backyard and your dog likes to go run out there, it's probably a good idea to just kind of take a look, make sure there isn't a dead bird out there. Keep an eye on them when you go to dog parks. Just kind of some general advice to do your best to keep them from eating and rolling in anything strange along those lines, especially at this time with all the migratory birds. We're about to have our spring migration come back up, so we'll probably end up seeing a lot more geese in areas and a lot more geese poop in fields. If you do think that your pet is sick or has been exposed, contact your veterinarian right away. Let them know what is happening, and then also monitor yourself for symptoms, just in case you were exposed as well, or if you end up getting sick. So basically just do another 10-day monitoring on both yourself and your animal. Contact your veterinarian. So we have a couple Colorado specific resources that you can use. So any sick birds or ones that have died from an unknown cause, you can call the Avian Health Hotline at Colorado State University. The number is on here, and we'll be able to, as I said, this presentation is recorded, so you'll have access to that later. And we also will be able to send these slides out to anyone who would like it after. So you'll have access to all the links and all the numbers on here. Multiple sick birds or multiple unusual dead birds in commercial settings, you should call the state veterinary office and the USDA's veterinary services within Colorado. If you find 3 or more dead birds within a 2-week period, or if a live bird or live animal is showing signs of disease, please contact your local CPW office. Do not handle the sick or dead birds if you do not have to, and do not try and handle or approach sick or dying animals of any kind, mammal or bird, if you do not have to. Just avoid those. And I said, if anyone that if yourself or anyone is experiencing any of the signs or symptoms of HPAI, you can contact us at the CDPHE at the email address there. So CDPHE_decipher_field epi. That'll send it right to the field epi teams one. You can also call the disease reporting line. It's a 2700 number on there, and our after hours number 9395. So CDPHE can be able to handle that call at any time. You can also reach out to your local public health agency as well, and make sure you talk to your primary care provider. So I want to thank you all for listening to me kind of drone on for about 20 minutes. And please, if you have any questions, please feel free to put them in the chat. Go ahead and unmute and ask me, or just have a great rest of your day. Either any of the above.
Yeah, I have some questions.
Yeah, absolutely.
So, can you kind of talk about what different types of birds are showing up with illness? I know that some waterfowl, obviously, but I've heard like eagles and stuff have actually tested positive.
Yeah, so unfortunately, it's not confined to just the migratory birds that we get down here in Colorado. So obviously the most of the ones that we see are Canada geese or snow geese. Those are by far the largest numbers that we tend to get. We have found it in owls as well. We've had some great horned owls. We have unfortunately had multiple birds of prey, eagles, hawks. Our raptor population has been hit by it, so that we do not have any specific like one species of wild bird, unfortunately, to look out for. It has hit quite a few of the wild bird populations.
Does that apply, I mean, to like vultures and stuff like that? Have you had any reports of that?
I don't. We may have had a vulture, but as far as I am aware off the top of my head, I'd have to go back through our
Okay.
whole bird line list to tell you for sure. But off the top of my head, that's not one that happens. We have seen it more. Some of the mammal cases that we've seen, we believe, have been from scavenging, but we haven't seen it in vultures from scavenging. At least, like I said, off the top of my head, I'd have to go back through our whole line list of,
Yeah.
of all our positives.
Okay. Thank you.
Yeah, of
Um,
course.
I have a couple more questions
Yeah,
unless somebody has
absolutely.
other questions. I don't want to hog you. Can we use like a flu swab to test people? And if they're test positive for flu A, is that even a more of an indication they need to get further testing from you guys or?
So it is, yes. So, apologize. I have some information on human testing as well. So yeah, it is basically just a general, I apologize. So it is just a general flu swab that we use. So we do use an influenza A swab. We use a viral transport media to send it in. So yeah, unfortunately, most of the commercial ones will not be specific for it. We do have a secondary panel that we will run to specifically tell whether it's H5N1 or another influenza A virus that is going on. So yeah, if you do end up having somebody that you're not necessarily thinking of that they have it and they test positive for influenza A, we can test them for a more specific one to see if they do have H5N1. Or they have the H5N1 specific type of influenza A. So but yeah, so we are running an influenza A panel. We're just running a slightly more in-depth one if we get a positive.
Okay, thank you.
Mhm.
Does anyone have any other questions? I just have one more. I'll go ahead and ask mine, and then we'll see if anyone else has any. Have you heard of any antiviral resistance with this virus?
Oh, so I have not. That is something, however, I can actually follow up with some of our med epis, so our epidemiologists that also have an MD, to double check if they have heard of any. We have not. We still will recommend. We have recommended all the same antivirals. Throughout for any treatment. So we do not really have any. We also, however, in H5N1, we have had very few cases worldwide, even less in the United States, that to kind of even see if there was any resistance to it. Based on our current numbers that we have of it, it's really where it seems like anyone who is symptomatic and treated early tends to have a pretty positive response to it. So that is, at least right now, that's still what we're recommending. We haven't seen any evidence of resistance.
Okay, thank you.
Mm-hmm.
All right, that consists of all my questions.
Okay. Is there any other questions on it? Also, I apologize if I went through too fast. If anybody would like to re-see a slide, I can go back to that, or like I said, it'll also be sent out later.
Great. Doesn't look like anyone has any other questions, but I really appreciate you being in here today, and we'll definitely get you to share those slides with me, and I'll send them out with the recording today. So
Awesome. Yeah, of course.
right.
Thank you so much for having me, and thank you everybody for sticking around to listen to the presentation.
Yeah.
Thanks, Greg. Appreciate it.
Thank you.
All right. Bye, everyone.
Bye, Stacy.